Did you know that around 5% of men and 3% of women suffer from sleep apnea? Over 50 million people in the USA alone suffer from it. It has really become a big problem, and for people who have been diagnosed with sleep apnea, they can have a long list of health complications. After many years of sleep studies and research, the CPAP machine, or continuous positive airway pressure machine, remains the gold standard for sleep apnea treatment. In this video, we'll be talking about how the CPAP machine actually works for sleep apnea. Don't forget to give us a thumbs up and subscribe to our channel for more amazing content on dreams, nightmares, and all things sleep. For those who don't know what obstructive sleep apnea is, it is essentially repeated interruptions in breathing during sleep, which can really result in poor quality of sleep and a host of related health problems. Some factors that increase the risk of obstructive sleep apnea include excess weight, as fat deposits around the upper airway can obstruct the breathing, being male as opposed to female because males are actually 2 to 3 more times likely to suffer from sleep apnea, smoking, as smoking increases the amount of inflammation and fluid retention in the upper airway, and it is said that people who smoke are 3 times more likely to develop sleep apnea. Another factor is nasal congestion, whether from an anatomical problem or from just seasonal allergies. Alcohol and other sedatives also increase the risk of sleep apnea, as these substances can relax the muscles in the throat, which can actually worsen your sleep apnea. And finally, your neck circumference. Interestingly, people with thicker necks actually have a narrower airway. A sleep apnea diagnosis is often made by a sleep specialist after the patient has undergone a sleep study. We'll explain what a sleep study is in another video. The CPAP machine consists of a mask that is worn over the nose or the nose and the mouth, a hose that connects the mask to the machine, and a motor that generates the air pressure. The machine is designed to deliver a continuous flow of air pressure through the hose and into the mask. The pressure of the machine is set by a sleep specialist to the appropriate level for the individual patient, typically around 4 to 20 cm H2O, or centimeters of water pressure, with the average being around 10 cm H2O. Some factors that affect the pressure settings for the CPAP machine device include anatomical factors such as people with smaller lower jaws, large tongues or tonsils, or their neck circumference is over 17 inches. A deviated septum limits airflow through the nose, so typically a higher pressure may be required. The body mass index, because overweight people are more likely to have extra throat tissue, restricting airflow to the lungs. And your sleep position, as sleeping on your back is generally believed to be the worst position for sleep apnea, as a downward pull of gravity puts even more pressure on the airway. Back sleepers will typically require higher pressure settings. On a side note, experts actually recommend side sleeping for people with obstructive sleep apnea, as it puts less weight and pressure on the upper airway. When the CPAP machine is turned on, it generates air pressure that is delivered through the mask to the patient's airway. This pressure helps to keep the airway open during sleep, preventing the collapse of the airway that can occur with sleep apnea. In a way, the CPAP machine helps the patient breathe more easily and comfortably throughout the night. CPAP machines can come in a variety of forms, including fixed pressure, auto-adjusted pressure, and bi-level pressure. Some CPAP machines also have built-in humidifiers to help prevent dryness and irritation of the nasal passages. It's important to note that the patient and the sleep specialist must work together to find the right pressure and mask type to ensure optimal comfort, because if the airway pressure is too high, it could actually cause discomfort, and if it's too low, it wouldn't be as effective to treat sleep apnea. Using a CPAP machine can greatly improve the quality of sleep for the individual with sleep apnea, reducing daytime sleepiness and increasing overall energy and productivity. In addition, treating sleep apnea with a CPAP machine can also reduce the risk of other serious health problems such as high blood pressure, heart attacks, and even stroke. In fact, sleep apnea can increase the risk of heart failure by over 140%, and strokes by 60%, and coronary heart disease by 30%. Also, there's a significant prevalence of psychiatric disorders, including depression and anxiety. It is really important to maintain the CPAP machine and the accessories clean by washing it and replacing the mask, the tubing, and the filters regularly to ensure the air delivered is clean and free of bacteria. If you have any questions about maintaining your CPAP machine, consult with your sleep specialist. Sleep apnea is a really serious sleeping disorder and should be treated right away. The CPAP machines are still the best treatment for sleep apnea, which can help people to breathe more easily and comfortably throughout the night, improving the quality of sleep and overall health. If you suffer from sleep apnea, we would strongly advise you to consult with your sleep professional right away. Do you have sleep apnea? What are your experiences with it? Let us know in the comments below. If you've enjoyed this video, don't forget to give us a thumbs up and click on that notification bell for more amazing content like this. Share this with a friend if you think they may need a little wake-up call. Thanks for watching, and until next time, sleep well.